My name is Dr. Hilsden, and you're watching my channel, Knife Skills. Today I wanted to talk about hernia meshes. If you're like me and you're watching cable television, YouTube, you're going to see a lot of media covering the issue of hernia meshes. And if you're someone who's potentially undergoing hernia surgery, you might be unsure or you might have questions about hernia meshes yourself. I do trauma surgery, general surgery, as well as other types of medical care in my previous practice. And I get actually a lot of questions about meshes. Whenever I counsel a patient on a hernia operation, the conversation of mesh needs to come up. Now, it's probably worth trying to understand a little bit about the history of hernias. Hernias, as I mentioned in a previous video, are essentially like a bulge of internal tissue that comes out through the musculature, and you can feel it outside. So basically, it's an internal structure that is now bulging through its containment, the fascia, as we say, and you can now feel it on the outside when you're feeling your groins or in the abdomen or where the hernia might be. Now, hernias have been around as long as human beings have been around. In fact, hernias are found in other animals as well. And the medical management of hernias has been something that's challenged doctors for centuries. As long as healthcare has had a profession, hernias have existed and hernias have been a challenge. Now, it wasn't until surgery became contemporary and we had proper antibiotics, anesthesia, and surgery became safe that actually using surgical skills to treat hernias became in favor. And in fact, it's interesting that in the past, some medical professionals even said there's nothing more challenging for a surgeon to deal with than dealing with a hernia. And really what they meant there is that despite all the efforts and all the techniques to put tissues back together, people who made hernias tend to have the hernias recur. And that actually makes perfect sense, because the truth is if you're a human being and you develop a hernia, if a surgeon takes the stitches and sews those tissues back together, it's unlikely that the surgeon's stitching is going to actually create a stronger set of tissues than what you were born with. And therefore, the process of using stitches to put a hernia back together, to fix a hernia, is associated with a high failure rate. And in fact, this was one of the many issues that challenged surgeons throughout the 20th century, was what technique could we use that could actually prevent hernias from coming back once we had them repaired. And of course, there have been many iterations, many changes to hernia repairs over the years. One of the more famous hernia repairs that they know is the Bassini repair, which is essentially based on reconstruction of the posterior wall of the hernia canal. So making sure that's sewn together properly in addition to fixing the hernia hole itself. Scholdice, a Canadian surgeon who has a very well-known clinic in Toronto, still uses a tissue-based repair or hernia repair based on stitches, and they use a very careful, complex construction of all layers of the abdominal wall to get your hernia repair. And in fact, I will say the Scholdice Clinic in Toronto has excellent results, and they produce results with a tissue-based repair that's similar to a lot of surgeons' results when they're using something called a tension-free repair or the mesh repair. Now, there are disadvantages to the Scholdice approach. First of all, it's not for everybody. They'll have a failure rate that's higher if they're including patients that have high body weight. If they include patients that have had hernia repair in the past and that have had a failure, they will also fail for very large hernias as well. Now, in my practice, I do quite a bit of abdominal wall reconstruction, And so I typically will see hernias that are larger in patient populations such as smokers or people with obesity that are more difficult cases. And whenever you're dealing with a hernia that's a more challenging hernia, you need to think about the chances of recurrence, and that's very high without the use of a mesh. In fact, the Bassini repair, which is the standard repair done by most surgeons who don't use a mesh, has a recurrence rate of up to 20%. You can compare that to a mesh repair, which has a recurrence rate about 1% to 2%, depending on where you read in the literature. And in fact, it was the Liechtenstein repair that became popularized in the 60s with the advent of plastic meshes. And since the 60s, truly, the Liechtenstein repair has become the standard of care repair for groin hernias. Now, there are different types of hernias. There's what we call ventral hernias or incisional hernias, and those also tend to benefit from mesh placement as well. But the real advent, where the real evidence lies, is in groin hernias. Now, that doesn't mean to say that there aren't risks with a hernia repair that includes mesh. Anytime you put a foreign material into a patient, the surgeon has to be incredibly careful with technique. The surgeon has to choose a mesh that's appropriately sized for the patient. The surgeon has to ensure that there's proper sterile technique. The surgeon has to ensure that the mesh is placed within the right anatomical location for it to be both effective and safe for the patients. And these are things that need to be considered. And when you're dealing with hernias, which are probably the most common operation done worldwide, maybe next to C-sections, there is hardly any operation that I could think of that would even come close to being done as frequently as hernia repairs. You're going to actually find that a significant number of complications will be present because there's so many repairs being done. Now, that does not mean that the mesh itself is a flawed concept. That does not mean that meshes alone should be eliminated from surgical care. That does not mean that you should be afraid as an individual if you're having hernia repair with a mesh. That does mean, though, that you should look for a surgeon who has experience. That means you should be aware of what type of meshes are being used and have a careful conversation with your surgeon. And probably one of the most important things is it's important for the patient to really decide in their own mind, how important is it that they have this hernia repaired? Because the reality is that in most cases, hernias are only mildly symptomatic. And when we study the literature, the fact is that those mildly symptomatic hernias, or the people who have a bulge and it's not bothering them at all, those patients rarely have complications. And therefore, hernia repair is not absolutely necessary. So if you want to have a hernia repair, that's something that's important. And you need to understand the options that are available. And you need to understand that the literature tells us very clearly that the best outcomes occur when the surgeon is using mesh. That being said, there's a lot of information out there and concern, and I know that individual patients certainly have had complications with meshes, and I definitely feel for you. When you have a complication with a hernia mesh, it can be a very significant problem. It's very hard to remove meshes once they're in place because they're so firmly attached to the abdominal wall. Essentially, that's why they work. Because they're so well attached, it's hard to remove them. There's chronic pain associated with the removal of a hernia mesh. So when you do have a mesh complication, although incredibly rare, they are significant. And because hernias are done so commonly, it wouldn't surprise me that someone watching this video themselves may have had a complication related to hernia repair. And for sure, I feel for you. But on the scheme of things, the reality is that far more patients benefit from having their hernia repaired with mesh, having a durable, safe hernia surgery with mesh. Far more people have benefited from that than have been harmed in the long run. Again, as always, I'm not here to provide you with individual medical advice. I encourage you to have a really close and careful conversation with your surgeon whenever you're dealing with these issues. And thank you for watching.